Carpal tunnel syndrome is common. It's one of the most common things we see. And at the most simple level, it's just a nerve that's being pinched. So we have a nerve called the median nerve that travels from the brain all the way to the fingertips. It passes through a space in the palm here, and that space is called the carpal tunnel. There's a lot of things that live inside the carpal tunnel, primarily that nerve, but also all the tendons. There's 9 tendons that move your fingers, and those have to share the carpal tunnel with the nerve. The problem is the tunnel gets too tight. When the tunnel becomes too tight, the little arteries that supply the nerve become pinched off, and the nerve doesn't work. That can also occur because of those tendons. If the 9 tendons that share that space swell up, the pressure within the carpal tunnel rises, and the nerve doesn't get the necessary blood, so it goes to sleep. The most common symptoms of carpal tunnel syndrome are numbness and tingling of the fingers, primarily the thumb through half of the ring finger. So this side of the hand becomes numb. It burns. People will describe electric sensations or tingling. Sometimes it can be severe pain. I will see patients who haven't slept. Other times it's not as much pain, it's just numbness, or they will complain of dropping objects or not being able to feel when they button their shirt. So the symptoms can vary, but to some degree, most of the time people have numbness and some pain. We start treating carpal tunnel syndrome with the minimally invasive or least invasive methods. So anti-inflammatory medication is one. A nighttime splint can be very helpful for patients. We routinely try steroids. Inside the carpal tunnel, there's inflammation going on. That's what's causing those tendons to swell. So if we can reduce that inflammation through the use of steroid, either a pill or an injection, oftentimes that will help. Ultimately, if all of this fails, then the treatment of choice is to open the carpal tunnel. The recovery from carpal tunnel surgery has improved significantly even in my 15-year career. So the recovery for the carpal tunnel surgery performed nowadays, and certainly the ones that are performed here, is much different. We allow immediate use of the hand, full range of motion. I do not recommend the use of a splint. We just put a soft bandage and allow patients to go back to full use immediately. There is a small incision, so we want to protect that and prevent infection. That means keeping it dry for a matter of days. I usually place 2 sutures, and those are left in place for about 6 to 8 days. But return to most activities is immediate. Return to heavy lifting activities or working as a mechanic or a carpenter will be on the order of a week or 2 before I would recommend that you attempt that.